Welcome everybody to today's webinar. Today we're looking at a Child and Family Services Guide to the Longitudinal Study of Australian Children. My name is Dr. Jasmine B. McDonald. I'm a research fellow and co-manager of the Child Family Community Information Exchange here at the Australian Institute of Family Studies. I'd like to start by acknowledging the Wurundjeri, Woiwurrung and the Bunurong people of the Kulin Nations, who are the traditional owners of the lands in Melbourne, where I'm speaking to you from today. I'd also like to pay my respects to elders past, present and emerging, and I want to extend that respect to elders and Indigenous Australians joining us in the webinar today. Okay, so before I introduce my guest, I have some housekeeping to share with you. So this is a pre-recorded interview, and that means we won't be taking any live questions today. The webinar will be available, the recording of today's webinar will be available in about 2 weeks on the aifs website. And the best way to find out about recordings or upcoming webinars is via the aifs newsletters, aifs News. But you can also go to our website and look under the webinars banner and you'll find the available recordings there. Today we have a accompanying resource information sheet for you that you'll find in your handout section of GoToWebinar, and this links to the LSAC website and also some of the really useful and interesting snapshots or findings from the study. And finally, in terms of housekeeping, at the end of the webinar, a feedback survey is going to pop up, and we'd really appreciate it if you would just take a little bit of time to let us know what you thought about the webinar and provide some feedback. We use that information to make sure we're covering topics and having conversations in a way that's useful for you. So please take the opportunity to do that if you can. Okay, now to the fun part. Today I'm joined by Dr. Lisa Mundy, who is the aifs program lead for the Growing Up in Australia longitudinal study of Australian children, or as we fondly refer to it here as LSAC. Lisa is a developmental psychologist specializing in life course epidemiology. The focus of her research has been understanding the psychological, behavioral and biological underpinnings of mental health, with the ultimate aim of informing new approaches to prevention and early intervention. Lisa has a particular interest in the interface between health and education. Prior to heading up LSAC, Lisa was the program manager of the Child to Adolescent Transition Study at the Murdoch Children's Research Institute. So we are really lucky to have Lisa as part of our team here at aifs, and I'm especially lucky to have you here with me to have a chat today. Welcome, Lisa.
Thanks so much, Jasmine. Thanks for the lovely introduction. I'm really lovely to be here. Thank you.
So a very good place to start is, Lisa, what is LSAC?
It's a really good question. So LSAC's a really exciting and really unique study based in Australia, and it's been following over 10,000 children and their families for the last 20 years. And it's a longitudinal study. So what that means is that we've been following the same children over the last 20 years and their families, and really understanding what it's like to grow up and to develop in Australia. And so, as I say, we've been following 10,000 children, and there's been 2 groups of children within that 10,000. So we started with 5,000 in what we call the baby cohort. So they were, as the name suggests, 0 to 1 when we started. And then there were 5,000 children in what we call the kinder cohort. And so they were 4 to 5 when we started. And so now those children and babies are now kind of moving from adolescence into young adulthood. So we're heading back out into the field later this year, and those children will now be, as I say, adolescents, so sort of 19, turning 20 years for the baby cohort and sort of 23, 24 years for the kinder cohort. So we're really looking forward to continuing to follow these children as they become young adults and understand what's going on in their world now.
That's huge. You know, so many participants over a long period of time. That's really powerful. But it does make me wonder, how do you run a project like that? Like, at a practical sense, what does this look like?
Yeah, it's a really good question. So it's a really huge team effort, like lots of partnerships. So Currently, the study is run in partnership between AIFS, the Australian Institute of Family Studies, where we're based, and the Department of Social Services, or DSS, as we tend to refer to them. And so DSS is one of the funders of the study, and then we at AIFS are running that study. And we work really closely with our fieldwork providers. And for wave 10, which is the next wave we're about to launch, that will be that Roy Morgan are our fieldwork providers. So we're working really closely with them, and they provide all the interviewers and the people who are going out in the field who meet our participants and our families who take part in the study. So lots and lots of people. We also have an advisory group who are really important, and they advise on all aspects of the study, sort of a scientific advisory group. And yeah, so thinking about the content that we put into the study, we have lots of advisors and sort of consultants across research and academia, as well as government and policy space. And it's really a broad study. So LSAC is, it's a really, really lovely study to work on, because kind of basically, if you're interested in it, LSAC is probably measuring it. So we capture a lot of data across, things like mental health, well-being, families, relationships with friends, things like bullying. Media use is a really big one, because obviously that's changed so much in the last 20 years, and this generation is growing up with technology now in a different way to previous generations. Things like employment now, volunteering, education, health, basically you name it, there's probably in LSAC somewhere. And as well as the information that we collect from the young people themselves, we also collect information from their parents, and also along the way we've collected it from their teachers as well, and sort of the early child educators, and then the interviewer in the home has also kind of provided some information as well along the way. So it's a really important study in that it's not just one person or like the child saying how they feel, or the parent, which is often the case in child and adolescent research. It's often the parent data that we rely on. So that's what makes LSAC really important, is having all of these different people informing the study and kind of, and providing that really important data. And then we also are really lucky in that we're able to link with some really important databases like NAPLAN, so in terms of like the educational outcomes for young people. So we've been able to link that in across grades 3, 5, 7 and 9, and we also link with the MBS, so the Medicare Benefits Schedule, and the PBS, the Pharmaceutical Benefits Schedule. So that means we've got some really really great complex data to really understand kind of what it's like to grow up, what are the factors that support kind of positive development, but also what are some of the factors that get in the way and that kind of hinder young people from growing up in the best possible way that they can, and their families. And then the kind of really exciting bit from where I am, as like kind of being a sort of a psychologist, having a psychology background, is really being able to then understand, well, where can we intervene? What can we do about this? And what are how can we make some changes? What are the targets for where we should be intervening earlier in development to make sure that all kids are on the best possible path they can be as they make those transitions from infancy to childhood to adolescence to young adulthood, and then hopefully now we'll be following them as they make those really important transitions into more adult roles and settling into employment, and sort of partners, and even eventually having kids and things like that.
Wow, that's really cool. And I love having this conversation with you and seeing the kind of enthusiasm and the excitement that you have for this study. That's really cool.
I love this study. This is like
clearly a data nerd. Respect. So while you were explaining that, and you really touched on the practical implications of this data, and also, as you were speaking before you said, I was thinking the same thing. It's really complex to draw all this data together. You have a psychology background, and so do I. And for us, longitudinal studies, something that we're kind of familiar with. But if people maybe don't have that exposure or understanding of what it is, could you talk through what we mean by longitudinal study and why it's a powerful method?
Yeah, of course. Yeah, so longitudinal means that we've been following the same children throughout the study. So for LSAC, over the last 20 years, we've run 9 waves of data collection, and they've typically happened every other year, so sort of every 2 years. Over COVID, COVID has caused disruption for LSAC in the way that it's disrupted pretty much everything else. So we ended up
not special, yeah.
Exactly. So we ended up doing a split wave. So there were sort of 2 parts to wave 9 that was in the field, and that really allowed us to look at what was happening for young people kind of earlier in the pandemic and then kind of later in the pandemic, so across kind of sort of 2020 and 2021. But in terms of, and then as I say, we're going into the field for wave 10, or sort of going out to meet the young people again towards the end of this year, like 2023. So that's a really exciting phase for us now, is kind of doing that preparation work. So in terms of the value of a longitudinal study and why it's so important and why I get so excited is because we are following the same children over time. And so we really get to see what happens for them as they're growing up and what's happening for their families. And that's the other important thing about LSAC, as I mentioned, because we're collecting data from other and information from other people as well. We really can build a picture of what life is like for the child and young person themselves, as well as their family, their community, and even to an extent kind of understanding the kind of the impact of sort of the broader society as well. So the value of having that longitudinal data is that you have the kind of data, you can really kind of look at those patterns that happen over time and then really understand what are some of those risk and protective factors, because you're tracking the same children. So you can kind of look at one point in time and then kind of effectively what we do is kind of almost like control for what's happening, what happened before that, so that then we can really unpack and sort of disentangle, well, what actually is driving that outcome. So maybe it might be mental health, and so for example looking at the role of social media and mental health, it's like, is social media, does it cause poor mental health, or is it something, is it young people who are more likely to have higher levels of emotional problems and more likely to be online? And so you can really disentangle that, because you know what happened for those young people, you know what their patterns of emotional behavior, emotional symptoms were leading up to them starting to go online, and then you can really disentangle that moving forward. And similarly with COVID and things like that, we've really been able to look at what happens when things like those sort of big disruptors like COVID come, to be able to unpack like what is the impact of that, and that's one of the things that we found, is that COVID for these young people really did impact their mental health and their well-being, and so that's like a really important. It's not just because we had the prior data, we could understand what their mental health was like prior to COVID, and then really understand that disruptive effect of the COVID pandemic. So yeah, so the value of longitudinal data is really important, and then coupled with being able to link with some of those kind of those what we call administrative databases, like the sort of NAPLAN and Medicare databases, means that it's a really really powerful, really amazing study that can answer so many questions. And it's so important for Australia in terms of being an evidence base to inform policy and program development, and it has done over the last 20 years. And that's something that we're really passionate about doing moving forward, is really making sure that the LSAC has impact and actually does help improve outcomes for children, young people and their families growing up today, basically.
Yeah, that's really cool. I am really interested when you're talking about collecting data from multiple people within a family system, right? Not just the young people, the children and young people. And this may be a conversation for another day. It might be off on a tangent, so feel free to tell me that, Lisa, that's fine. But it does make me wonder, often as researchers, we're looking for triangulation. We want to hear similar things from different sources. But what do you do when parents and young people are saying different things, like the data's diverging? As the program lead, What do you do with that?
Yeah, it's a really good question, and as someone who's worked in research for a long time, it's definitely a challenge, and particularly when you're designing these studies, you obviously want to make sure that we set them up so that we're only asking the kind of the smallest number of questions that we can as well, because we really value the families, the young people's time. So we don't want to be in their house for the whole day, like that. So we have to think really carefully about who's the best person to ask these questions to. And so it's a really good question, and particularly for a longitudinal study like LSAC. So as I mentioned, we started when the children were sort of babies and sort of 4 to 5 years of age. So that age, it's obviously but from babies, obviously you can't collect any data, minimal what you can get from a 4 to 5 year old. But we know that from sort of around 8 years of age, kids become quite, like, if you ask the right questions in the right way and provide the support and help them understand what the questions mean, then young people can start answering questions from around 8, 9, definitely 10 years of age. So that's when we start bringing in more of that kind of the child's information, because that's really important in terms of understanding what's life like actually for them. And we've actually done one of our technical report papers that's coming out really soon on this topic. So for anyone who's a real data nerd who wants to know more, then I definitely will make sure that we post that. It's not out just yet, but it will be really soon. And so we have really looked at this question about like who different respondents and the sort of reliability of that. And in short, kind of what we know from the kind of broader literature is that parents are probably not so good at saying about emotional problems. Like, that tends to be the young person themselves is a much more reliable informant of that. But behavior problems, typically parents do know that, because they tend to be the things that they get rung up by the school or hear about through their friends, or obviously just are observing.
Yes.
So there's different kind of there's different kind of value of different informants about different things. And so thinking about the age and stage of the child, and where they're at in development, and thinking about what they can realistically answer, and then thinking about where's the most reliable informant. That's kind of the challenge, I guess, in terms of putting together the questionnaires. And then in terms of kind of analysis and thinking about, well, what does this mean and what do we use? It's all of those factors kind of come into that end as well. And there are ways of doing kind of what we call kind of composite and blend those together, or you might kind of look at both and just consider them as almost like two different outcomes, or two right. Almost two different entities, that sort of thing. So but definitely a really important consideration, as in terms of longitudinal study, well, in terms of not just longitudinal studies, but work with children. Absolutely. And young people.
Yeah, that's exactly what I was going to say. Is I'm hearing the descriptions you have there and thinking that there's some interesting takeaways there for practice as well, of who can you bring into the conversation, hear different voices, what's the whole is greater than the sum of its parts kind of situation. Yeah,
exactly. And I think that's right. I think it is about putting all of those different voices together to build the picture, and understanding the different like the way that plays out in terms of development. Like, one of the previous studies I've worked on, we had a big focus on puberty and pubertal development. So earlier on, parents are pretty good informants of that, but then as development goes on, parents really don't know much. And so like understanding the age of the participants, or the young person that you've got in front of you, and who's going to be the how you build the picture of the information that you want, that you need to collect to kind of think about. It's really important decisions.
And that makes heaps of sense in terms of that developmental changes of parents being such an important part of a child's world, and then post-puberty maybe having less direct information.
Exactly. And that's one of the really important transitions. I mean, that's one of the ways that LSAC and studies like LSAC can really shine light on some of those really important transitions as well. So that that's a big passion area of mine, that transition from kind of child to adolescence for for lots of reasons, and understanding how you can support the role of parents in that transition, whilst allowing the young person to kind of have their, you know, their level of autonomy and agency develop across those years as well. But yeah.
For sure. Okay. I think it would be nice if we could just like briefly touch on various topics that you have covered in this study. And so far we've got social media, we have COVID, we've actually covered a bunch, but are there any other kind of areas you'd like to highlight to say, hey, we've also got, you know, snapshots or data in these spaces as well?
Yeah, definitely. So as part of the work that we do here at aifs, we produce a number of what we call snapshots, which are basically sort of a summary of some of the research findings that we're doing. And they're across a whole range of topics, and they're available on our website. And yeah, as I say, a lot of breadth in LSAC, so there's lots of different topics that we can cover. But maybe just to give a bit of a highlight, I might just go back actually to the COVID and young adults one. That's one that came out earlier this year, and just talk a little bit more about that, and then we can go on a little bit of a tour around some other topics as well.
Excellent.
But that's good. Great. So as I mentioned, yeah, what we found, so the young people were sort of in that just sort of in that sort of early 20s basically, when we were looking at this in 2020, and it was at the early stages of the COVID pandemic, and so we were really interested in understanding kind of what life was like for these young adults basically, who were making that transition from adolescence into young adulthood. And we found that I mean, it's been it's been a lot in the media, but there hasn't been that much kind of data to back it up. But we found that young adults really did find lockdowns in particular hard, and that they experienced a range of difficulties as a result. And we found that females were particularly affected in the restriction periods during those lockdowns. And so we found that they reported higher levels of loneliness, social isolation, and also really importantly, they also reported lower levels of motivation and concentration with their study as well. So that's really important in terms of thinking about, you know, even things like the role of universities and tertiary education, the role of schools for preparing young people to make that transition, and thinking about the kind of the skills that we're building in young people so that they're able to kind of navigate this transition into young adulthood, and then, you know, deal with the kind of setbacks that come. Obviously the pandemic was, let's hope, you know, a bit of a one-off, but I think it does show the challenges that young people face, and that, you know, that they really do need extra support during this time. And interestingly as well, I think this phase of life is typically kind of almost invisible. Like, we put a lot of focus on younger children, which is obviously completely right, a lot of development happening there, and we want to, you know, set kids up for success. But really thinking about the support that we provide for young people as they make this transition into young adulthood is really important as well. And we also found that a higher than normal group of young people who'd moved out of home had returned to live with their parents. So thinking about like those transitions into adult roles, these young people had made that transition out of home, and now because of the pandemic were moving back home with their parents, and they had a range of increased needs in terms of sort of financial and emotional and just pure advice. So thinking about, again, the role of parents, you know, and that kind of how they support their young person, like, you know, the idea that parenting stops when a kid hits 18 is, you know, not true, as I'm sure lots of parents with young adults out there would say. So so just really thinking there about what the the needs of young people, shining a spotlight on what's happening for them, and thinking about how we can support them and their families just more generally, and obviously at the kind of times of kind of when there are these disruptors as well that might kind of knock things off course. And that's why it's a study like LSAC is really important, because we really need to understand now what, like, have they now transitioned back out again? What has that disruption, what's that done to, you know, for those young people, for their parents? have they like reset and everything's back on track, or or are there some sort of still bumps in the road? And so kind of being able to understand what's happening is again another real strength of a study like LSAC, in being able to follow now and see what's happening kind of post pandemic. So that's kind of one topic, and then other topics. I think we might do another session on this one, like in terms of the roles of pro-social behaviours and mental health, but so I won't go into that too much, other than just to say that we've found that those pro-social behaviours, so kind of really fostering that in children, those behaviours in terms of like sharing and caring for others, is really important for later well-being and mental health. And then other topics, things like gambling as well, that we've looked at, and we found that adolescents, I should say, who were playing simulated gambling games during adolescence were more likely to spend like real money on gambling as young adults. And there you can see a kind of a direct relevance in terms of policy and thinking about kind of and that's obviously kind of literary data from LSAC is kind of helping to inform some of those discussions that are happening now. So, and again, we also, as part of that work, looked at the role of parents as well, and found that parents who were gambling and who had higher levels of alcohol consumption, that their young adults were more at risk of gambling as well. So then really, thinking about the kind of family factors that put that young person at risk as well.
Yeah.
So that's a bit of a taster of some of the different topics, and as I say, these are all on our website as well. So there's an opportunity to go and read a bit more about.
I love how we could talk for multiple hours on any of those specific topics. Like, that's just a few. That's just a couple of research, policy, and practice implications. Yeah. Excellent. And so, you've touched on probably where I'd like to take this next. These snapshots are available on the website, so people can access that content there.
Yep.
But I'm wondering about the availability of the data outside of aifs and DSS. What does that look like? Can people access it?
Yep, so DSS make the data available for anyone, and it's free of charge. So there's details on the Growing Up in Australia website, which we'll make available around how to access it. And there's just a couple of forms, but it's a fairly straightforward process, and you can ask any questions, sort of get in touch along the way, and we can help facilitate that. But yeah, anyone can access the data, and there's different kind of releases of data as well, and so there's a sort of a sub-study, which is the Child Health Checkpoint study as well, which has more detailed data about health in sort of young adolescents as well.
Okay. Great. And is the website the best place if people have questions or queries about the study or any of the snapshots? Is it best for them to go via the website, or how could they reach out?
Yeah, the website's probably the best place. We are in the process of updating the website, so watch this space, and any feedback welcome. But yeah, the website's probably the best place. We've got all the snapshots, all of the technical reports as well, for anyone who might be kind of more interested in the kind of data side. Lots of FAQs for data users, and on there as well, in terms of how to access the data and those sorts of things. And we also run data user workshops as well, if anyone's interested in kind of getting more familiar with the data, and we'll kind of be developing some more resources in that space as well over time. So I think the website's the best hub, and then any questions funnel through there. Yeah.
Excellent. Okay, well, I think we're kind of coming towards the end of our catch up today, which has been super interesting. I'm keen myself to actually keep doing some more digging and reading and discussing these things with you. But I guess a way I'd like to close out our chat is for you to maybe let us know what's happening in the next kind of short term for LSAC. So there's going to be a new website. Anything else you wanted to mention?
Yeah, so we're updating the website, and then we're also, as I mentioned, so Wave 10 will go, be going out to meet our participants and families this year. And some of that work has started already, so that's really exciting. And then we'll be kind of upping that towards the end of the year. Next year is our 20-year anniversary, so we're in the process of planning some events, so watch that space. And yeah, I think that's yeah, we're really looking like, yeah, really keen to hear from people who are interested in the study, using the study. Get in touch, because we want to make sure that this study goes from strength to strength, really. So keen to make sure that we help people use, access, find the findings, access the data, and so on. So yeah.
Yeah. Great. I love the idea of LSAC, the study, being personified and celebrating a 20-year birthday. That's really cool. It's such an achievement. These kinds of studies take a lot of resources and teamwork to keep on track and to keep people coming back to provide data over that length of time. So it's really impressive.
It's definitely a testament to the team, but I think the most important group to thank are the young people themselves and their families, because without them, literally the study would not exist. So I'm always forever grateful for them taking part. It's a big part of their lives. So to be part of a study like this, so we really appreciate the time that they put into the study.
Yeah, well said. I think that's a nice way to round it out. So yeah, thank you to the LSAC participants. Thank you, Lisa, for having a conversation with me today and sharing insights and having a bit of a laugh along the way with me. It's been quite enjoyable on my end.
Likewise.
Before we finish up, I'd also like to thank the aifs team behind the scenes that have helped to set up the webinar today. And to those of you who are watching the webinar, thanks for joining us. Hopefully there's been some kind of interesting takeaways. Remember that there is the feedback survey once the GoToWebinar webinar closes. So let us know what you think. I'm really keen to see those responses and hear your thoughts. And yeah, I'd like to remind you again that in case you want to share this webinar with colleagues or watch again, that the recording will be available on the aifs website in about 2 weeks. So if you haven't already, please subscribe to aifs News, and you'll hear promptly when the recording is available. And that's it for today. We hope that you can join us for our next webinar, which is an LSAC kind of 2.0 webinar, where, as Lisa suggested, we're going to do a deep dive into one of the LSAC research snapshots that looks at how children's childhood pro-social behaviours, such as volunteering, are associated with adolescent mental health. More details about that one will be available next week. So thanks again, Lisa.
Thanks, Jasmine. Thanks, everyone.